All right, good morning and welcome everyone. It's 9 a.m. and so we're going to get started with our first pre-session. Obviously people are going to be walking in and out, and of course that's totally fine during this session. But this pre-session is about a really important initiative by the Parkinson's Foundation about the hospitalization of a Parkinson patient. And what can you do to prepare, and what can you do to make that experience the best possible. With us here today we have Sally Levy, who's a community program manager for the Parkinson's Foundation in Ohio, and we're really excited to have her presentation about this important topic. So please give her her warm welcome.
Hi, good morning. My name's Sally Levy, as he said, and I am Community Program Manager of Ohio for the Foundation, and just really grateful to be here, so thanks for having us. So good morning. Thanks for making it to the pre-session. I hope you all got some good coffee, and we'll just jump right in. So first I'm going to really focus on our Aware and Care initiative and how you can get the best Parkinson's care if you are ever in the hospital. It may sound a little negative at first, I'm just going to warn you, but we'll move in a positive direction and steps we can take to stay safe. So I hate to be the negative Nancy, so I like to warn we will move in a positive direction. But just want to make sure everybody's aware of going into a hospital situation, what can happen, what challenges may be there, and how to stay safe. And then just so you know, I have a table out here, and we've got a lot of Aware and Care kits, which we'll go over. So if you're interested in those or didn't grab one on your way in, feel free to stop by and I can get you one. So really, why are we here? We're here to better understand the risks that are associated with hospital stays, and please keep in mind that means planned or unplanned. So it may be an emergency, it may be a procedure that you have planned. We're here to really get tools for you to advocate for yourself and play an active role in your care when you're in the hospital, and to develop strategies to make sure that you do get the best possible care, to be aware and care. So when we look at Parkinson's and care transitions, typically with the general population, the really difficult transition is when they're going from the hospital to the home. So we know on average 1 in 5 Medicare beneficiaries discharged from the hospital are readmitted within 30 days. So with Parkinson's, we know a lot of times it's the reverse. So the challenge is transitioning from home to the hospital. And you may have this awesome medical regimen that you follow at home to a T, and then you may face a lot of challenges continuing that when you're in the hospital. So we all think hospitals are safe, right? Who wouldn't? You assume that a lot of things will happen, and a lot of times any problems may not be, to the fault of your care provider. It may just be a lack of knowledge, and we'll go through things that can happen. So first, just because it is the morning and we might as well warm up our voices, we'll do a little bit of true and false. So I was going to do a little raise your hand thing, but we might as well warm up. So true or false, they will call my neurologist. So just shout true if you think that's true. Oh, okay, great. Good job, team. We're doing good so far. So false, they may not call your neurologist. They may not know you're seeing a neurologist. Big X on that one. So when we look at the pharmacy, will have my PD meds. So do we think true or false? Really loud. False, I think. Okay, good job. We're all awake. If you're not, if you got it wrong, feel free to grab some more coffee if you need to. Then not all staff understand the symptoms of Parkinson's, so not everyone understands it. Whoa, I heard a mix. One more time, really loud. True, okay, cool. Yeah, so that is true. Threw a little curveball in there. And so they will give me my medications on time at the hospital. Excellent. Okay, and I think this is our last one. They will know the contraindicated medications, so the medications that may not be good for a person with Parkinson's. False. Okay, I'm hearing a little bit of a quieter false, but I know you're just waking up. So great. So that's the reality, and we just want to be prepared that often is the reality. When we look at Parkinson's and hospitalization, In this study of 100 patients, um, 1 in 3 patients with Parkinson's were admitted, and then 3 and 4 of those patients had their medications changed in some way, whether it's not on time or the medication regimen changed. And 2 and 3 of those folks had complications. So of the 33 admissions, 16 had complications. So that's a pretty significant amount. So we know that people with Parkinson's in the hospital have a 1 in 4 chance of complications because of medication errors. And the reality is that people with Parkinson's are hospitalized 44% more than their peers without Parkinson's. Just a reminder, I told you this is the negative part, okay? We'll get to the more positive, what can we do, what steps can we take? But also we know that people with Parkinson's suffer avoidable complications at a higher rate than people that don't have PD or patients that don't have PD. And this often yields longer hospital stays than non-Parkinson's patients may experience. So then we look at why is this happening before we think through what can we do. So even in the best possible, in the best scenarios, in the best hospitals, there can be a lack of understanding of Parkinson's disease. If you've ever been in the hospital, which I'm sure many of us have for one reason or another, you know the number of people that are coming through and seeing you and checking on you. And so imagining, if all of those people could know about Parkinson's, but the challenge that educating all of those people presents. So there may be a lack of understanding. Also, hospital pharmacies may not stock all of the Parkinson's medications that you may need, and non-Parkinson's specialists may not be fully aware of the critical importance with Parkinson's of medication timing, making sure you get your meds on time. They also may not know that many common medications aren't safe for people with Parkinson's. So we also know that only 25% of hospitals have a mechanism in place to contact a person's Parkinson's doctor, whether you're seeing a neurologist or movement disorder specialist. They may not have, there's not that big red alert, call their neurologist, even though sometimes we assume that they would do that. So that's a really important part of advocating for yourself or your partner to make sure that they do that. We also know that 70% of hospital staff are unaware of the drugs that worsen Parkinson's motor symptoms or are contraindicated for people with Parkinson's. So sometimes, unfortunately, it is on you to educate them, and that's what we'll get into with the Aware and Care Kit and what we want to help you do. And as far as the lack of awareness, as I said, there's lack of awareness of how important it is to get those meds on time. Some of the common medications that are used in hospitals for pain, nausea, depression, psychosis aren't safe for people with Parkinson's. A great example of that is Tylenol that's often used. And we also know that if you aren't getting your meds on time and they're not managing your Parkinson's well, that you may have some mental confusion or other serious symptoms that can, if they don't realize you have Parkinson's or may not know much about it, they might see that as something different and give you a medication that may not be good for your condition. So once again, we know hospitals are complicated. We've got nurses coming through, physical therapists coming through, your provider coming through. So many providers are excellent and wonderful, but they may not be experts in PD. You may be more of an expert in Parkinson's than they are. So today we really want to learn how to navigate those situations and some paths and tools you can use to try to improve your care if you are ever in the hospital. So a couple more of the challenges, just to make sure everybody's aware. A little bit of this is repetitive, but just really want to drive home so that you're aware of what can happen in the hospital and know what to push for and advocate and how to advocate for yourself. So as we know, there's a lot of medications that can be used for Parkinson's, and everybody's medication regimen may be different. We also know that a lot of contraindicated medications are not recognized by the folks in the hospital and sometimes by the patients. And a lot of this, we've already talked about changes in times and dosing, or if they didn't have the medication you normally take in the pharmacy, that may change how you're feeling. And then, of course, if you have difficulty with swallowing, that may change what the medication formulation you typically have or the way they do that in the hospital for you. And then also there's the mobility challenges that you can face, that can be worsened in the hospital. So we always recommend that Parkinson's patients mobilize and start moving as early as they can. Say you have a procedure, just making sure to start moving as soon as the conditions allow. That ambulation reduces chances of worsening rigidity and the associated symptoms, things like that maybe your care provider may not realize, and so you just want to speak up and make sure as soon as you're able to and it's safe to get moving. And then we know Parkinson's patients are heightened risk for falls, and patients and care partners should discuss risks associated with lack of movement with the doctors, the physical therapists, getting them involved, making sure they know what's going on, and what you're like as a person with Parkinson's. And that kind of brings us to our roles. So as a patient and care partner, you know your disease the best. Person with Parkinson's, you know what conditions maybe make you feel worse, maybe make you feel better. You know your combination of medications and the regimen. And each person with Parkinson's is typically the most knowledgeable of any particular needs you may have, any particular communications challenges that you may have. But when possible, having a care partner there is also so important because you see it all as well. A lot of times you know it all as well. I'll let you guys decide who knows it better. We don't need to decide that here. But you can help advocate in those situations. And sometimes you're the one that has to step in with this kit or with the providers to make sure everyone knows that somebody has Parkinson's. So when we look at how do we change the outcome? So we're moving towards the let's take some steps to take care of ourselves. This is just a picture of our medical alert card, which is in our Aware and Care kit, which I'll go through everything that's in there. But we really want to make sure to advocate for right medications on time. So not a different medication that they think might work, but the correct medications that you typically take and on time with your regular regimen. And never any of the contraindicated medications I already mentioned, Haldol. So, and in some hospital systems and situations, they will allow you, if you bring your, in our kit, pack your medications in their original bottles so you have the exact instructions from your doctor in case it takes them a second to get in contact with your doctor. And then sometimes they'll allow you to, take those yourself, sometimes not. But it doesn't hurt to bring those and make sure, take every chance you can to remind the providers of your typical regimen. So Aware and Care, we're here to help. Our campaign is really to help keep folks informed, and that goes across the board. So folks with Parkinson's, their care partners, the hospital staff, healthcare providers. So we're really just trying to spread the word about the importance of this across the board. We just started this past year our Aware and Care Ambassador program and actually have a handful down here in Cincinnati, which is great. So really just spreading the word about the importance of medications on time and how to stay safe and use this kit to take care of yourself. So then when we look at the kit, and this is what I've got out here in the hallway if you're interested in one, there's a lot of goodies in the kit. It looks like this cool bag that you can carry around and put your medications in, but it also has a lot of good stuff inside. These are pictures of some of the stuff we have updated the bracelet. I don't think the kits here have the new one, but it is going to be a more comfortable bracelet soon. But we've got in the kit, we've got the bag so you can pack your medications, or at least some of your medications with in their original bottles, have it ready. In the kit, there's also a booklet about creating a hospital action plan so that you can learn how to prepare for your next hospital visit. And once again, it's whether it's planned or unplanned, planned or emergency, just that you're always ready and just regularly thinking about, how do we handle this best? And then, as I said, we've got the ID bracelet, which is great, especially, if it cramps your fashion style throughout the week, at least wearing it if you are in a hospital situation, as many reminders as we can get for the providers that you do have Parkinson's, the better. It's got a really good medical alert card in it that you can put in your wallet and put your emergency contact information in there. Always you can pull that way you can always pull it out if anybody ever needed to see that or have that reminder. Then there's also a really good medication form that you can fill out with your medication regimen. I always just encourage, keep it up to date. We've got a great fillable PDF of this also on our website. So if writing is a challenge for you, and typing, if that's better for you, you can always type that in, print 10 copies, print whatever, as many as you want, or make copies so that you have them. And that's really handy for any doctor's appointment, any appointments you may be having, but particularly if you're in the hospital, you have it ready to make sure folks see it written down. There's also a general Parkinson's disease fact sheet, which just is easy. You can ask the hospital staff to put that in your chart, so anybody coming through, checking over your chart, can quickly at least get a heads up that you have Parkinson's and maybe learn a little bit about it before walking into the room and working with you. And then there's the great I have Parkinson's reminder slips. So these have on these lists of medications that should be avoided, medications that are safe, so are really important, and there's a whole pad of them, so you can just, each person coming through, or have them hang it up on the marker board they often are writing their number on. And then a handy magnet. I've heard some people love this so that they can, put up their medication form in the room with them. Always point to, just always reminding. I know I'm driving that home, but as many tools as you have to really push that, use to advocate for yourself, the better, so that you don't feel like you're just having to, make stuff up, and just always reminding yourself. So as far as taking some action at home, I always just, line up help. Make sure that we always say this, but make sure your care team is together. And continue to build your care team, with your connecting as often as you can, your care providers, your care partner, your physical therapist, anybody that you're working with. And if you need to build that out, seek out those resources, talk to your doctor about how you can build up a care team and keep everybody aware of what's going on. And of course, pack your aware and care kit. Review the materials if you get one today, when you get home. I know you'll want to fill it with all your toiletries, but wait, look at what's in there and really review what's in there so you know and you're ready to use it. Add in that emergency contact list, fill in those medication forms, kind of get in the habit of updating those. And just prepare for the unexpected, as we said. Wear your ID bracelet when you can. Put that alert card in your wallet. It's so easy to just pop it in there. And just always be kind of talking about, what is the emergency plan? It's a simple, it doesn't have to be a big elaborate thing, but just having talked about it can sometimes help when you do get in those urgent situations. And of course, find a good hospital when it's possible. And as we said, some of the best places just may not have experts in Parkinson's in the area when you're there, especially emergency rooms. So just the best you can. Of course, if you hear of hospitals that are better as far as caring for PD in those situations, but just always checking up on that. And be vocal, as I said a million times. Use the fact sheets, use the materials we provide, and be vocal. If you've ever been in that frustrating hospital situation with your loved one with Parkinson's, you probably are already a professional at being vocal, because a lot of the stories I hear is, I was vocal, I had to demand they call my neurologist. So you're probably already a professional at that, but just remember, it's okay to speak up. It's scary sometimes, but at a certain point you have to do that, and you do need to ask that they connect with your doctor and that they make sure you get your medications on time. And be persistent about that, and update, the care team, ask for help if no one's listening. And then, of course, as we said, start moving as soon as you can. after a procedure. Ask for physical therapy in the hospital if that's something that would help you. Find out if you qualify for physical therapy when you leave the hospital, once you're discharged, and just stay on top of your care. Work with your care partner, your loved ones, on all aspects, keeping everybody up to date on medications, treatments, tests. I know a lot of you are probably like, trust me, I hear this all the time, like I'm always up to date, but it never hurts to just, especially if there's a hospitalization that happens, make sure folks know what's going on and what you've been going through. And then, of course, provide feedback. Positive, negative, provide feedback to the hospital. And if it's not the next day, and you need to recover for a bit, a month later, provide feedback, fill out that survey, give them a call, advocate for people with Parkinson's that are going into the hospital in the future by contacting that hospital, letting them know the quality of care they may have provided. And lastly, just connecting with others. If you're not already part of sport groups or exercise classes, I know there's a lot going on down here in Cincinnati. So definitely connect with others. And if you need local referrals or more information about resources, always feel free to contact our foundation hotline as well. Helpline. And then we already talked about this, when should I use the kit? Could be planned emergency visit or your regular checkup with any of your care providers. And just to let you know a little bit about the Aware and Care initiative, it is a national campaign, so we do send these kits out throughout the country, and we are working to educate healthcare providers as much as we are able to and get in and better understand how hospital systems are working and if there are ways we can change policies or be part of that to improve this day, because we know it has to happen on a variety of levels. But we're grateful to all of the sponsors of the, my slide stopped. To all of the sponsors for Aware and Care. Okay, it stopped, but we're done. So grateful to the sponsors that have made Aware and Care happen: Edmund Safra, Philanthropic Foundation, AbbVie, Acadia, Medtronic, and they've really helped us get the word out and get these kits in the hands of folks that need them. And then just lastly, wanted to share, I know I've gone a little quickly, but a little bit about the Parkinson's Foundation. We are a national organization, and our mission is to make life better for people living with Parkinson's. So we do that by trying to improve care with initiatives like Aware and Care and our Centers of Excellence program and our helpline. We also work to advance research. We invest about $10 million per year in research for people with Parkinson's. Could be research related to quality of life, could be about finding a cure, could be about figuring out what's causing Parkinson's, really just to move the research forward around Parkinson's. And then lastly, really just want to be here to bring the Parkinson's community together as a whole, and whether that's through our education events or our moving day walks or our volunteers or patient advocates, we really just want to bring folks together. So it's great to be at events like this where we can all get together and be in the same room, share ideas, share tips, and just learn more about how to deal with Parkinson's. So thank you so much for having me today, and I hope that I left you with a little bit of hope and some steps to move forward. And just once again, if you'd like a kit, just pop down to my table at any point today, and I can get you one of those. And hopefully I'll run out, and then I'll order them for you. So either way, just come see me. Thank you.
Thank you so much, Sally. That was an awesome talk. Just so I can get a sense, by a show of hands, how many people here have Parkinson's and have been in the hospital in their life? Okay. So you know some of the challenges that we're talking about here. These are really great things to think about ahead of time and to plan for. These kits offer you a concrete way to help to advocate for yourself. So certainly check them out. They're free of charge. Right, so just see if it's something that you'd be interested in getting, and then if they run out, they will be able to order them for you online. All right, so we have a little bit of break while we tear down this wall. We're going to make this one big tribe again, and then in just a little bit, we'll have the welcome to the full program. Thanks.